News reports have claimed that I'm anti-vaccine or anti-industry. I am neither. I am pro-safety. I am pro-safety. I worked for years to raise awareness about the mercury and toxic chemicals in fish, and nobody called me anti-fish. And I believe that that vaccines play a critical role in healthcare. All of my kids are vaccinated. I've written many books on vaccines. My first book in 2014, the first line of it is, I am not anti-vaccine, and the last line is, I am not anti-vaccine.
2021, in a book called The Measles Book, you wrote that parents had been, quote, misled into believing that measles is a deadly disease and that measles vaccines are necessary, safe, and effective. The reality is measles are in fact deadly and highly contagious, something that you should have learned after your lies contributed to the deaths of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
I went there, nothing to do with vaccines. I went there to introduce a medical informatics system that would digitalize records in Samoa and make health delivery much more efficient. I never gave any public statement about vaccines. You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either.
Anybody who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say that it targets black and white people but spared Ashkenazi Jews?
I quoted a study, Your Honor. I quoted an NIH study that showed that
I'll take that as a yes.
races
I have to move on, I have to move on. Did you say that Lyme disease is highly likely a materially engineered bioweapon? I made sure I put in the highly likely.
I probably did say that.
Did you say that?
And that's what the developer of Lyme
I want all of
disease
our
said.
colleagues to hear it, Mr. Kennedy. I want them to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Did you say on a podcast, and I quote, I wouldn't leave abortion, to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term. Did you say that, Mr. Kennedy?
Senator, I believe that every abortion is a tragedy.
Did you say it, Mr. Kennedy? This matters. It doesn't matter what you come here and say that isn't true, that's not reflective of what you really believe, that you haven't said over decade after decade after decade, because unlike other jobs we're confirming around this place, this is a job where it is life and death.
President Trump has sworn to protect Medicare. Republicans are exploring reforms to Medicaid that could help pay for Trump administration priorities. With this context, what will you do about dual eligibles?
About
dual eligibles?
Well, dual eligibles are not right now served very well under the system. Those are people who are eligible for both Medicaid and Medicare. I suppose my answer to that is to make sure that the programs are consolidated, that they're integrated, and the care is integrated. I look forward to working with you, Dr. Cassidy, on making sure that we take good care of people who are dual eligible.
And how do you propose that we integrate those programs? Does Medicare pay more, Medicare pay less, Medicaid pay more, Medicaid pay less? How do we do that?
Well, I'm not exactly sure because I'm not in there. I mean, it is difficult to integrate them because Medicare is under fee-for-service. It's paid for by employer taxes. Medicaid is fully paid for by the federal government, and it's not fee-for-service. So I do not know the answer to that. I look forward to exploring options with you.
You have started a group called the Children's Health Defense. You're the originator. Right now, as I understand it, on their website, they are selling what's called onesies. These are little things, clothing for babies. One of them is titled Unvaxxed, Unafraid. Next one, and they're sold for $26 a piece, by the way. Next one is No Vax, No Problem. Now, you're coming before this committee and you say you're pro-vaccine. Just want to ask some questions. And yet your organization is making money selling a child's product to parents for $26, which casts fundamental doubt on the usefulness of vaccines. Can you tell us now that you will, now that you are pro-vaccine, that you're going to have your organization take these products off the market?
Senator, I have no power over that organization. I'm not part of it. I resigned from the board.
That was just a few months ago. You founded that. You certainly have power. You can make that call. Are you supportive of this?
I've had nothing to do with leadership.
Are you supportive of these onesies?
I'm supportive of vaccines.
Are you supportive of this clothing, which is militantly anti-vaccine?
I am supportive of vaccines.
Right.
I will. I want good science, and I want to protect.
But you will not tell the organization you founded not to continue selling that product. Thank you, Mr. Chairman.